Today we are going to focus on another technology used during medication administration, smart pumps. We've reviewed barcode medication administration, or BCMA, which is also used during medication administration to confirm that the patient is receiving the correct medication by scanning a barcode on the patient's wristband and a barcode found on the medication's packaging. Smart pumps are infusion pumps that help ensure that medications are infused at the right rate. Today's primary purpose is to introduce some terminologies associated with smart pumps and their use. A smart pump, in very simple terms, is a computerized infusion pump. Infusion pumps are devices that administer drugs to a patient through intravenous, subcutaneous, intramuscular, intrathecal, epidural, or intraarterial routes. We will focus on delivery via the intravenous or IV route today. Infusion pumps can administer fluids in a very controlled way. While traditional infusion pumps are manually programmed by individual clinicians, smart pumps are programmed to include a very specific set of data. Traditional pumps are volumetric, while smart pumps are dose-specific. Software for smart pumps are designed to prevent dose-to-rate calculation errors, wrong administration unit errors, and other administration errors. This slide lists several features that smart pumps offer. The first is a customized drug library. A drug library is a list of medications with predefined clinical parameters that are specific to the hospital and even to the clinical area. Smart pump technology also offers clinical care area profiles, which enables customization of the data based on the type of patient. For example, your hard stop for a maximum potassium chloride dose may be vastly different for a pediatric patient versus a 35-year-old patient. Smart pumps have the capability to provide advice about the medication being infused and set dosage limits, often referred to as soft or hard stops. A soft stop is an alert that indicates that a pump is programmed outside of the normal range, but allows the provider to continue with administration. A hard stop typically indicates that a drug is programmed at an unsafe dose. In contrast to soft stops, hard stops do not allow the provider to continue with programming the pump. These pumps also lend themselves to standardization of IV concentrations. Finally, smart pumps provide us with a lot of data. We can see who is overriding alerts, how often alerts are acted on or overridden, and which drugs and what doses are producing alerts. This slide lists additional features of smart pumps. Some hospitals are equipped to allow wireless connectivity to the pumps. This feature is ideal because it allows for pumps to update without having to manually upload a new library in every pump when the library is updated. Wireless connectivity also allows for the electronics transfer of IV medication orders from the EHR to the smart pump and the transfer of start times, stop times, and other details back to the EHR. Another feature is the ability to default a rate based on the infusion. For example, dopamine may be defaulted to infuse at 5 micrograms per kilo per minute. This slide lists additional features of smart pumps. Some hospitals are equipped to allow wireless connectivity to the pumps. This feature is ideal because it allows for pumps to update without having to manually upload a new library in every pump when the library is updated. Wireless connectivity also allows for the bidirectional transfer of information. It allows for the electronic transfer of IV medication orders from the EHR to the smart pump and the transfer of start times, stop times, and other details back to the EHR. Another feature is the ability to default a rate based on the infusion. For example, dopamine may be defaulted to infuse at 5 micrograms per kilogram per minute. We mentioned that the customized database of medications contained in the software is called a drug library. For each medication infusion in the library, you are able to specify a standard concentration, appropriate dosing units, for example, milligrams versus micrograms, the infusion type, dose limits, infusion times for boluses, like bolus over 15 minutes, and any special advisories that may be warranted. As you can see on this slide, smart pump adoption has steadily increased over the last 10 years with use in more than 80% of hospitals, so you are very likely to encounter use in the health system in ambulatory infusion settings. Here I show the process for programming a smart pump. The first step is to determine the clinical area where the medication is to be infused. This is helpful because if the drug requires special monitoring or training for administration, it will only appear in the areas that are appropriate for administration. For example, you may only display carboplatin and antineoplastic in areas appropriate for chemotherapy administration. Next, you would determine the type of infusion. This is important because infusion times may vary based on whether or not it is a bolus or basic infusion. Next, you would select the drug and sometimes the concentration to be administered and program the dose and rate. Finally, you would address any alerts and begin the infusion. The most significant limitation to smart pump use is the ability to bypass the medication library with dose checking. Even though IV infusions are associated with 56% of medication errors and 61% of serious and life-threatening errors, some still program pumps outside of the library. Also, there is still a manual component to programming the pump, and there are lots of steps in the process, so it does take time. When nurses are busy, under time pressure, or in emergent situations, there is a tendency to program the pumps outside of the library because it's quicker. Finally, it takes a culture committed to accountability and safety to enforce use of the smart pump safety software. Leaders need to commit resources to examining the data and identifying non-compliance with organizational expectations. Any technology has its limitations. Smart pumps are dependent on accurate data entry. The provider must choose the right drug and concentration from the library in order to calculate rates and doses. Secondly, alert fatigue is a real phenomenon. If there are too many alerts, providers begin to bypass them and ignore them. Smart pumps are good for gathering data on use and practice, but don't necessarily identify errors that are happening. There's no ability for smart pumps to detect a dosing error that falls within the recommended infusion dosing, even when the dose isn't correct for the patient to whom the medication is being administered. Medication administration is a very high-risk step in the medication use cycle, due to the fact that errors made here are the most likely to reach the patient. BCMA and smart pumps are tools that, when used effectively, can reduce chances for medication errors. This concludes the presentation. Thank you for your time and attention. If you have any questions, please don't hesitate to reach out to me.